do the best we can. Okay, so some other factors. Think about the level of control needed. So for muscles that move the eyes, you're talking about maybe 10 muscle fibers connected to a single nerve cell. Whereas other forceful activities like the quadriceps would have several hundred muscle fibers that are controlled by a single nerve cell. So the level of force needed is also an important factor. Okay, so any questions about motor units? That's the first factor that affects force production, motor units. Okay, so second factor that affects force production, the muscle length tension relationship. So at what length is a muscle when it initiates contraction? So on the inside of a muscle cell, you have these contractile filaments. So you have the myosin filament, sometimes called the thick filament, that binds with the thin filament that's sometimes called actin. Okay, so you have the thick and the thin filament, myosin and actin, and they bind together. Okay, well, muscle length affects how much myosin is bound to actin. Okay, so if we have a change in length, we gradually have less interaction between myosin and actin. So less actin and myosin bound together means what for force production? It's going to drop because force production is directly proportional to the amount of actin and myosin that's bound together. So what that also suggests is there's probably a range of motion with each joint where we have the most actin and myosin bound together. So how many of you have noticed with weight training there's usually a region where it's a lot more difficult to move the weight? Sometimes we call that the sticking region. And then there's a portion of the range of motion where it becomes a lot easier to move the weight. That has a lot to do with this length tension relationship. So how much overlap we have in these contractile filaments in the muscle cell. So the greatest amount of active tension, active means actin and myosin are bound together. We're using ATP to maintain that interaction, is produced at about 130% of resting length. That doesn't mean the muscle's resting, it just means the muscle has a little bit of a stretch to it. So we get the most interaction between those little contractile filaments when a muscle is just a little bit stretched when we initiate contraction, is what that means. So motor units, length tension. The third factor has to do with velocity. Okay, so how fast is a muscle contracting when we measure force? So I want you to take a look. This graph has the three muscle actions. So it has a concentric side, it has an eccentric side, and on the x-axis we have increasing lengthening velocity. So on this side of the graph, that means a muscle is lengthening with increased velocity or speed. On this side, this means a muscle is shortening or contracting with increased velocity or speed. So in the middle we have zero. Zero velocity or speed is what type of muscle action? Isometric. So there's no velocity with isometric. Everything is static. So I want you to notice this nice little curve that describes the force with different muscle actions at different velocities. So we can look at this side and say, okay, for concentric actions, the relationship between force and velocity is inverse. What does it mean when two variables are inversely related?
One goes up, one goes down.
Yeah, so one goes up, the other goes down. Good, Connell, that's exactly right. So with increasing velocity, what happens to force during concentric actions? Force drops. So concentrically with less velocity, so I'm moving in this direction, lesser velocity means what for force? Force is going up. So during concentric actions, there's an inverse relationship, velocity and force. Velocity goes up, force goes down, velocity goes down, force goes up, until eventually you have no velocity left. And what type of muscle action do we have there? It'd be isometric, so we don't have any more movement. So isometric, we have a higher amount of force versus any level of concentric action. You have zero velocity. So you see this is the force. So it's gradually climbing, climbing, climbing. At zero velocity, we have greater amount of force. Okay, eccentric side of the curve is a little bit different. So we defined eccentric as lifting or lowering?
Lowering.
Lowering, okay? So imagine this as lowering. This describes maximal eccentric actions. So what that means is that weight is coming down no matter what. So you're holding a bar over your head, and you're just holding it there, so there's no movement. So what type of muscle action would that be? That'd be isometric. Okay, so then you have a couple people out to the side, and they begin adding plates to either side of the bar, and you're still trying to hold it over your head. Okay, so eventually what's going to happen? You're going to start lowering it, and you're doing your very best to not lower it. But it's coming down anyway. Don't try this. Okay, so gradually it starts to come down, and you start to have some velocity, right? So as you add more plates, you're still trying to keep that bar from coming down, but it's coming down. And as you add more plates, what happens to the speed as it begins to drop? Speed is going to get faster, and the level of exertion, the level of muscle effort to keep it coming down is going to do what? You're going to increase. So to a certain point, as velocity increases during the lowering phase, the force output will also increase. So we call this a proportionate relationship. Until which point you see that drop off right there, that's when you just can't hold it anymore and you have to drop it. So that's an example. Not a practical example, but kind of helps illustrate what that means. So this is maximal eccentric actions, maximal concentric actions. It's not just, a submaximal amount of weight that you're lifting, say 6 to 8 times. It's when it's maximal force for both sides. Okay, so the stretch shortening cycle. This ties in really well with the myotatic reflex, because when muscles undergo, when muscles are loaded during a load phase or a quick stretch, we not only have that reflex, but we also have storage of energy. Storage of energy, elastic energy. So a muscle undergoes a quick stretch, and we've stored this energy that we can use upon contraction. So the stretch reflex is really important because it determines efficiency. And if you're like Brian and you cover lots of ground, you want to be very efficient, like a fuel-efficient car. So we can talk about this from a physiological standpoint, because athletes that can utilize the elastic properties of their muscles expend fewer calories to run at a certain speed. So we look at elite level endurance athletes, and they're very efficient. So it's not necessarily a difference in VO2 max, because you look at a couple of world-class endurance athletes, their VO2 max is probably pretty similar. Their anaerobic threshold is probably pretty similar. So what's different? And we talked about this in physiology. A lot of it has to do with efficiency. Efficiency. So there's things, this is more of a biomechanics discussion, but things you can do with your technique, your running technique, or your swimming technique, or your cycling technique, and so on, to make you more efficient. So using the stretch, shorten, cycle, practicing, quick, elastic type movements. So in training, what type of movements tend to emphasize the stretch, shorten, cycle? You've all done them. Plyometrics, right? Plyometrics. What do plyometrics involve? They involve a quick stretch and then what? And then a jump, right? So plyometrics, series of jumps. We learn to use the elasticity of our muscles by quickly stretching them and then initiating a contraction like jumping. So very important for efficiency. Okay, so the next factor that affects force production is the angle of pull. Angle of pull. So what tissue attaches muscles to bones? Tendons. Okay, so we're talking about the angle of the tendon relative to the bone. That's the angle of pull. So it's the insertion angle. I like that, the insertion angle. At what angle is the tendon pulling on its attachment point? So we have three different parts. And actually this is biomechanics, so you've heard this before, but we get a little bit of a taste of this in kinesiology. So rotary component is the first component. The angle of pull represents the angle on the inside of a tendon, close to the bone. So we're talking about not this side, not the far side of the tendon, we're talking about the part that's closer to the bone. So this inside part right here. So this is an angle of pull of, what angle would you say that is roughly? Yeah, 90 degrees angle of pull. We have 100% of this rotary component. 100% rotary component. That means 100% of this muscular output is acting to flex the elbow joint. So this is the bicep brachii that's represented there. So all of it, 100% of that muscular output from the bicep brachii is acting to flex the elbow joint when we have an angle of pull of 90 degrees. So that's another factor that can affect strength, because at some points during a range of movement, we're going to have a greater angle of pull, a greater rotary component. Okay, so a couple other scenarios. Now the bicep brachii is used a lot because it lends itself well to examples like this, but you also need to understand that other muscles have angles of pull. Any muscle that is used to move or to lift or to lower things has an angle of pull. So a single muscle here makes it very simple. So when the elbow joint is extended, we're not talking about the angle of the elbow, okay? Because when the elbow joint's extended, it's the angle of the forearm relative to the upper arm is about 180 degrees. Does everybody see that? We're not talking about that angle. We're talking about the angle of insertion. So this angle of the bicep tendon relative to the radius, right in here. This tiny little angle right here. So that's less than 90 degrees. So we're not talking about the arm as a whole. We're not talking about forearm versus humerus. We're talking about this insertion angle right here where the bicep inserts. This angle right in here is less than 90 degrees. So in this case, we have two parts. We have a rotary component. Okay, for the bicep, what does the rotary component do at the elbow? The rotary component flexes the elbow. The other component stabilizes the elbow joint. So the stabilizing component pushes the radius and the humerus tightly together to stabilize that whole elbow joint complex. So the stabilizing component has nothing to do with flexion of the elbow joint. It's directed this way towards the joint. So all we're saying is that this muscle, in pulling onto its attachment point, has two parts. It has a part that flexes the elbow and a part that stabilizes the elbow joint. So is everybody clear on how that works? Everybody understand that this is less than 90 degrees because we're looking at this little angle right in here, rather than the arm as a whole. Okay, the very last component of the three. Okay, this is the dislocating component, and that sounds bad because we don't want things to dislocate, but it's just pulling the joint surfaces apart, or tends to pull them apart. It doesn't actually do that because the elbow joint, the congruence of the joint makes it so you can't, it's really hard to dislocate it. So what we've got is an angle greater than 90 degrees. Okay, so here's the bicep tendon. We're talking about this angle right in here, right inside here. This side is greater than 90 degrees. So again, we have two parts. We have the rotary component that does what? That's the part that flexes the elbow, but we've also got this other part acting in this direction that tends to pull the elbow apart. But that doesn't actually happen under normal conditions. Okay, so does everybody understand angle of pull? So at positions where we maximize the rotary component, that's where we're going to be strongest. So what's the practical application? Let's talk about it. Why do we have all this? What's the bridge over to the practical? So let's say, how many of you know someone that can't do a single pull-up? I do. Okay. All right, so can't do a single pull-up. So how can you take someone that can't do a single pull-up and help them so that eventually they could do a single pull-up? Okay, well, maybe you could start with chin-up. And because we know that the rotary component is greatest at 90 degrees, that's where the force is going to be the highest. Maybe you could have them start with some isometric holds, almost like a flexed arm hang, but not above the bar. Where would you want them to start off with, where the rotary component is the greatest? You want them to start right there. Okay, you'd have them hold for a period of time as long as they can, because that's where the rotary component is the greatest. So you'd have them hold at that point as long as they can, and then of course they could slowly lower their body, because which action are we stronger, eccentric or concentric? Eccentric. So we're stronger eccentrically, so you could have them hold right here where the rotary is the greatest, and then have them slowly lower their body, taking advantage of that eccentric contraction. So then over time you would gradually start to incorporate the lifting part, which is really that's the challenge, is the lifting part. So that's one application. Okay, so right at the end of chapter 2. So hang on with me. We're gonna get just through chapter 2, then we'll call it a day. So uniarticular, biarticular, multiarticular. What do those words mean, you think? Muscles that act on 1 versus 2 versus more than 2. Okay, so uniarticular muscles cross and act directly on one joint. So the example would be the brachialis. Brachialis is deep to the bicep brachii, and it's oftentimes called the true flexor of the elbow. The bicep is a multi-articular muscle. It acts on the shoulder, it acts on the elbow, and it also acts on the proximal radial ulnar joint. The brachialis, in contrast, has one job, and that's to flex the elbow. So it's uniarticular. Another example would be the soleus. So the soleus only acts on the ankle joint, and its job is to plantar flex. So we have lots of examples of muscles like that that have just one action over a single joint. So sounds like Scout's ready to go. So biarticular is two. Okay, so lots of examples here where a muscle has action at two joints. So the rectus femoris has its origin up here at not the anterior superior, but the anterior inferior iliac spine, so it's a little bit below there. And then has its insertion down here at the tibial tuberosity. So the rectus femoris acts to flex the hip and extend the knee joint. So when the nervous system activates a muscle wants to do all of its actions. So the rectus femoris is activated, its tendency is to flex the hip and extend the knee. So the nervous system has to activate other muscles. If just knee extension is desired, then we have to neutralize the action of the rectus femoris in flexing the hip. So then you've got to activate other muscles that keep the hip extended to counteract the rectus femoris's tendency to want to flex the hip. So can you see how this multitask, even an action that might seem simple like extending the knee, you have to neutralize the action of the rectus femoris at the hip, so you're just getting the desired action. So the nervous system is sending signals for muscles to act as neutralizers or stabilizers or agonists or antagonists all at the same time. The hamstrings. Okay, hamstrings has three parts: biceps femoris, semitendinosus, semimembranosus. So all three parts, with the exception of the short head of the bicep femoris, have their attachment here at the ischial tuberosity. The ischial tuberosity is sometimes called the sit bone because you're sitting right on it. So you're sitting right on the origin of your three hamstring muscles minus the short head of the bicep femoris. So is it any wonder that your hamstrings get tight if you're sitting on them all day long? So wouldn't it be great if you had a foam roller in your apartment at home that you could kind of get those glutes and everything rolled out at night? Okay, highly suggest you do that. So very important to understand that a muscle can usually do one action or the other, but not both to the greatest extent at the same time. So it's very difficult to get maximal hip flexion and maximal knee extension at the same time. Very difficult for the hamstrings to maximally extend the hip. And what do the hamstrings do at the knee joint? You guys know, yeah, flexion. Okay, so you can't get, it's very difficult to get maximal extension of the hip and maximal extension of the knee joint at the same time. So a muscle will try to do all of its functions, but it's hard to do both to the greatest extent at the same time, is my point. So that brings us to this principle of active insufficiency. Active insufficiency is when a muscle reaches a point where it's so shortened or contracted that it can't produce any additional force. When a muscle becomes shortened to the point that it cannot generate or maintain active tension. So this can be a good thing in some ways. So the practical example would be if we're doing a glute bridge, what's the position of the knee joint? During a glute bridge or a barbell hip thrust, what's the position of the knee joint? It's flexed. And what are we doing during a barbell hip thrust or a glute bridge? What are we doing with the hips? We're extending. So in other words, we're doing both functions of the hamstrings at the same time. We're flexing at the knee joint and we're extending at the hip. So remember, a muscle can do really well with one or the other, but not both to the greatest extent at the same time. So what happens is with a glute bridge, because the hamstrings are flexed, because the knees are flexed, the hamstrings become actively insufficient. So what muscle tends to be emphasized then in extending the hip? Yeah, gluteus maximus is the emphasis because the hamstrings are actively insufficient. Let me give you another example. Go ahead and slide back in your chairs. Let's talk about my favorite muscle, the sartorius. Okay, so slide back in your chairs, and I want you to assume the worst posture possible as you're sitting there in your chair. I want you to lean back, nice and sluggish. Okay, so, all right, so at this point, let's talk about the sartorius. The sartorius flexes the hip and flexes the knee. So it does those two things. So while you're leaning back with the hip nice and extended, I want you to take your right ankle and put it over your left knee. Just go ahead. Humor me a little bit, put it over there. I know you have hurt. Okay. All right, so that's pretty easy to do because in flexing the knee joint, what's the position of the hip? It's extended. Okay, and now again, the sartorius does what? It flexes the hip and flexes the knee. So if we want the sartorius to do its best in flexing the knee, how do we want the hip? Not flexed, but extended. Okay, so the sartorius is more effective at flexing the knee joint if the hip is in extension versus if the hip is in flexion, because then the sartorius becomes actively insufficient. We're doing both actions of a muscle at the same time. Okay, so let's demonstrate active insufficiency. I want you to flex at the hips and bring your chest down to your lap. And whatever you need to do, shift to the side or whatever you need to do, put your chest down in your lap. So now what is the position of the hip? Thanks, Sam. That's hard for you to do. So what's the position of the hip now? The hip is flexed. So now keeping your hips in maximal flexion, I want you to take your right ankle and try to cross it over your left knee. Okay, so, all right, so to illustrate the concept, why is that so difficult to do? Because with the hip maximally flexed and with the knee maximally flexed, the sartorius is actively insufficient. Okay, so another example. So why is it that seated calf raises, how many have seen a seated calf raise machine? Has the plates loaded on the pin on the front. Okay, so why is it that the seated calf raise emphasizes the soleus? Why is it that the gastrocnemius is kind of de-emphasized? Well, it has to do with active insufficiency. So what are the functions of the gastrocnemius? Gastrocnemius, obviously, what do we call that? At the extension of the ankle is plantar flexion, but what is not as talked about is the gastrocnemius also is a flexor of the knee joint. So in a seated calf raise, what's the position of the knee joint? Flex. So when you try to do plantar flexion with knee flexion, how well does the gastrocnemius work? Not very well. So then what muscle takes over plantar flexion then? The soleus for seated calf raise is the emphasis, which isn't bad. I mean, the soleus needs to be trained too, but if you want to train the gastrocnemius, you probably want to be in a more standing position. So passive insufficiency is just the opposite, where a muscle becomes so lengthened, right here, reach when the opposing muscle becomes stretched to the point where it can no longer lengthen and allow movement. So taking the opposite example with the hamstrings become passively insufficient when they become excessively lengthened when we try to flex the hip with the knee in full extension. So you're laying on your back in a supine position, just like we did with the active straight leg raise test. What did you feel in the hamstrings as the further up you raised your leg into flexion with the knee extended? There was more tension, right? So if you had someone kind of gently move your foot further into hip flexion with your knee still extended, what would be your perception in that muscle? under a lot of tension, probably some pain too, right? It would be uncomfortable. So that's passive insufficiency. So the difference between the two is active insufficiency is we're trying to contract a muscle. Passive insufficiency is where we're trying to lengthen a muscle. And this only has to do with joints that are acting on, or muscles that are acting on more than one joint. These two would apply. Any questions? Okay, I think, yeah, that's good. We did it. So, okay, so what's next week? We'll start on chapter 3. Wednesday's your exam, so make sure you look over the study guide. Monday's lab, we are going deeper into the overhead squat. So thank you. Hope you have a good rest of your day.